San Antonio Psychiatric Nurses Association. Our mission is to eradicate mental health stigma and to support members' educational and professional advancement, networking, and communities engagement. Now, we the Board of Officers would want to introduce to all the very first SAPNA Psychiatric Nurses Impact Award. Focusing on the great contribution of our psychiatric nurses on the field of clinical practice, education and research, leadership and management, and community service. We also have special awards such as Rising Star Nurse of the Year, Educational Scholarship Winners, and Hildegard Peplow Impact Nurse of the Year. This awarding right is a symbol of gratitude for all the services and contributions of our psychiatric nurses to our patient population, their families, and the San Antonio community. SAPNA Psychiatric Nurses Impact Award.
Hi, good evening everyone. My name is Andrea Quintana. I am a psychiatric health nurse at University.
Thanks everybody. I really appreciate the award and the nomination.
Thank you so much for this honor. During my 27 years as a registered nurse, I have
Hi, I'm Cheryl Hare. I'm a board certified mental health and psychiatric nurse. I've been a nurse since 19.
Hello, my name is Lisa Obong Oji. I want to thank my PCC.
Hello, I am Maria Danet Lapis Bloom, Associate Professor and the Director of International.
Hello everyone. I am truly humbled and honored to receive this award.
Hello everyone, my name is Cynthia Plata. Thank you so much. I am extremely grateful, and psychiatric nursing has been my passion and love for the last 24 years. Advocating.
Go.
Hi everyone, I'm extremely honored to be
Hello, my name is Jamin Gusta.
Hello, my name is Roland Sauerland, RN.
Hello, my name is Mark Alonso. I'm a psychiatric studies.
Good evening, colleagues and friends. I am honored to be the recipient of the Psychiatric Nurse.
Good evening. I just want to start off by saying thank you so much for this nomination.
Good afternoon, and thank you all for joining us virtually. On behalf of the San Antonio Psychiatric Nurses Association, we welcome each and every one of you to today's event, the very first SAPNA Psychiatric Nurses Impact Awards. My name is Gerard Santo Domingo, the founding president and the current awarding committee chair for the organization. Joining me today as my co-hosts are the 2021 Board of Officers, and they will be presenting nominees and the winners in each categories. A little bit of history. The San Antonio Psychiatric Nurses Association was founded in the year 2018 with 24 active members. The team collaborated to form the organizational structure. Moving to this year, we have now over 80 active psychiatric nurses as our members from different psychiatric institutions all over the San Antonio area. This year as well, the Board of Officers want to raise awareness of the contributions of the psychiatric nurses to clinical practice, leadership and management, education and research, and community service. Moving forward, this event will be conducted yearly to make it meaningful and to celebrate our dear psychiatric nurses' achievements and accolades. For our event, in light of the significant work and contributions of the nurses during the COVID-19 pandemic, we will be recognizing and celebrating psychiatric nurses who have had given great importance to our psychiatric patient populations during these trying times. The special and honorary award of the Hildegard Peplau Impact Nurse of the Year will encircle to this criteria. To get us started, we now welcome our dear Mayor of San Antonio, Ron Nirenberg, to give us a welcome message. He is well known in supporting nurses' causes and whose vision was one of unity for all nursing professional organizations of South Central Texas. Without further ado, let's welcome Mayor Ron Nirenberg.
Hi, I'm Mayor Ron Nirenberg. Welcome to the San Antonio Psychiatric Nurses Association Impact Awards and Educational Conference. Thank you for allowing me to be part of this virtual event. While the coronavirus pandemic continues to spread in our community and around the globe, we are fortunate to have the upper hand over the virus these days because of the medical miracle of vaccines. The vaccines provide a comforting emotional boost in addition to protecting us from COVID's insidious attacks. It has been a tough 16 months as we changed our lives and habits to prevent the spread of the virus and keep our community as safe as possible. And you know firsthand what many of us have read about. Our community's mental health and well-being have suffered because of the pandemic. COVID-19 brought many disruptions for all of us, especially for families with members who contracted the disease. Quarantines and isolation replaced working at the office and socializing in all sectors of the community. The pandemic brought new stress, new challenges, and increased anxiety, suicidal thoughts, and substance abuse. Even as you dealt with the same pressure that made the pandemic difficult for all of us, you continued to serve. Psychiatric nurses always play a crucial role in our society, but the pandemic amplified the need for treatment. The work you do helps save lives and makes our city a better place. You're making a significant difference, even when your work is not adequately recognized or appreciated. We understand a lot more about mental illness than previous generations, but the stigma persists in many quarters. And our community owes a debt of gratitude for your work to eliminate the social stigma that is attached to mental illness. Congratulations to those who are receiving awards tonight, and thank you to all of you who continue to work in this demanding and difficult field. We don't say it often enough, but we appreciate your dedication to healing people. There is no more noble cause. Enjoy your conference and keep up the good work.
Thank you for that very supportive and heartwarming welcome speech, Mayor Ron. SAPNA truly appreciates your support. And now, we would want to introduce the judges of our awards winners. First on the list, Paul Buckle. He is the Director of Nursing, Inpatient Psychiatry and Behavioral Health, University Health. Maria Ostrander, Chief Nursing Officer, Psychiatry and Behavioral Services, San Antonio State Hospital. Kimberly Vollmer, Chief Nursing Officer for Mental Health, Audie L. Murphy, Veterans Affairs Hospital, San Antonio. Braden Butterfield, Chief Nursing Officer, San Antonio Behavioral Healthcare Hospital. Carol Carver, Senior Vice President and Chief Operating Officer, Clarity Child Guidance Center. Marie Frary, Director of Nursing from the Center for Healthcare Services. Billy Mahone, Director of Community Engagement, South Alamo Regional Alliance for the Homeless, or SARA. And Sarah Schultz, Director of Nursing, Psychiatry and Behavioral Unit, Laurel Ridge Treatment Center. We thank all of them for accepting the challenge of being the judges for the very first SAPNA Awards. They are truly appreciated for the support they give to the association and the psychiatric nurses. Even with their busy schedules and hardships, they were still able to accommodate our requests. Thank you all so much, judges. Moving on to our program, the SAPNA receives almost 60 nomination submissions. 58 of them are complete nominations for 38 nominees. My co-hosts will provide short snippets of the narrative provided by their nominator for each nominee. As for transparency, the judges' scores will be shown alongside nominees' profiles and accomplishments. The judges judge all the winners by blind judging through their profiles, and the nominees' names and institutions where they work were blacked out for equality and fairness. The presenters will be Cara Hernandez for Leadership and Management category, Marlon Mantaring for Community Service category, Deborah Hopi for Education and Research category, Alexandria Olivari for the Clinical Practice category, and lastly, our current president, Maria Lourdes Cruz, will announce the winner for our special awards, which are the Rising Star of the Year, Scholarship Winner, and last but not the least, our Hildegard Praplau Impact Nurse Award, who in this season contributed greatly for our psychiatric population during the COVID-19 pandemic time. Without further ado, let us all now meet the nominees.
Our first category is Leadership and Management Award. Points are awarded based on the following criteria. Must be currently practicing in the field of psychiatry nursing and must have occupied the position of administrator, director, manager, and nurse in charge. Must have demonstrated innovative leadership practice in any healthcare setting, and must have been recognized for significant contributions to leadership. Our nominees for the Leadership and Management Award of the Year are Orlan Vincent Acero. This nurse takes care of patients with certain medical needs along with psychiatric disorders. He performs his duty not just as a med-surg nurse, but also uses skills of a psych nurse such as redirecting, pacifying, and understanding the needs of the patients on our 7th floor medicine unit. Implementing and combining, but not to the extent of modifying protocols for 2 different departments to give quality care to his patients. He understands the needs of certain patients, and even when they can't express it, he finds a way. He talks to them, and he gains their trust to better assist them with their care. He anticipates their actions beforehand, and he is prepared, instructing us to do certain things to prevent injury or harm to the patients and his coworkers. He sticks to the rules and regulations and makes sure patients understand this. Even if they don't, he will further provide explanations so that they can understand. He thinks about the safety of the one-to-one sitters as well. Orlan doesn't just assign sitters randomly. He makes sure that they are comfortable with their assignments, and if not, he will find a way to either make changes to it, or he will give us the necessary tools to care and protect the patients as well as the staff. Maria Lourdes Cruz. Malu has been an RN for over 20 years now. She has a vast knowledge of nursing experiences ranging from pediatrics, post-anesthesia, surgical, medical, rehabilitative care, and psychiatry. All this has made her an even more well-rounded yet humble individual. Due to her broad experience and outpouring humility, Malu became an instant target to be the next manager in the psychiatry unit in University Health, wherein she is right now. Malu is a highly respected manager by her colleagues and subordinates for her willingness to help anyone, anytime she can. She has been instrumental in helping institute new unit-wide cost-saving procedures. She is very well organized, diligent in her work, easily reachable, flexible, and always on time. She has shown excellent leadership skills on both units by keeping up with the policies and making sure that employees do the same through education and reminders. She is very understanding and compassionate to both employees and patients with a high level of professionalism. Cheryl Hare. Ms. Hare works at our South Bear Outpatient Clinic, SBOPC, as a behavioral health nurse. They do not normally give long-acting injections at this clinic, but she is trained to do so. There is a veteran that is currently staying at the Summit, a transitional housing facility that houses 95 residents and is close to the SBOPC. Secondary to the COVID pandemic, the facility was hesitant to allow the veteran to ride the VIA bus for an hour and a half to the VA Medical Center, go inside the hospital to get his long-acting injection, then take the 1.5 hour bus ride back to the facility. But they knew the injection was vital to his mental health care and that delaying so would be detrimental to the patient. In a collaborative effort, their case manager reached out to Cheryl, who coordinated with her leadership to be able to have the injection mailed to the Summit. They notified Cheryl when they got the injection, and the patient only had to take a 15-minute bus ride to the SBOPC and did not have to come to VA Medical Center. This truly represents our flexibility and highlights our efforts to provide patient-centered care and enhance the patient access to care. Ms. Hare displayed outside-of-the-box thinking and led the collaborative process to take care of the veteran. David Hicks. His nominator said, "I know he's an extraordinary nurse manager and nurse." David obtained his nursing degree from the Army and went to work for SASH 7 years ago. Sometime during his tenure, he became the nurse manager of Navarro Hall, SASH's geriatric unit. I have worked with him and seen him perform duties of an RN, PNA, housekeeper, and as a family to patients, all on top of his manager duties. I have seen him clean tables, haul trash behind his back all the way to the dumpster behind the unit. I was amazed. During the snow crisis early this year, which SASH dubbed as Snowvid, he was both RN and LVN, or medication nurse, for his unit of 20-something patients with several AccuChecks, tube feedings, and dressing changes. There is nothing he wouldn't do for his beloved patients. I have seen him sit down with them, talk to them, comfort them the way I'm sure he would do for his own family member. Cynthia Links. With a DMP degree in Executive Administrative Management from the UT Health San Antonio and an MSN degree in dual-focus Psychiatric Clinical Nurse Specialist and Nursing Administration from UT Austin, she is a highly motivated nurse professional, experienced clinician, and versatile healthcare senior leader with years of experience in a variety of healthcare settings, including inpatient, ambulatory, military, and managed healthcare. She has proven abilities as an administrator and educator to collaborate and lead diverse teams in educational endeavors and process improvement initiatives at the local, state, and federal levels. She is a quality improvement leader and collaborator within managed healthcare, oncology, and psychiatric services, along with population health and community wellness. She is a lifelong learner, striving to continuously expand understanding of leadership, quality improvement, and mental health practices. She is a servant leader, supporting others, providing resources to help them reach their full potential. She is an astute organizational professional, providing ideation, design, and innovation to promote process improvements to streamline work increase efficiency, and enhance safe healthcare practices. Tamara Marquez de la Plata. Her nominator wrote, "In light of COVID, vaccinations this year were more important than ever." Ms. Marquez de la Plata collaborated with pharmacies and social workers in the homeless program to go out into the community and vaccinate veterans residing in homeless shelters, including Haven for Hope, the GI Forum, and the Summit. With Tamara's coordination and leadership, the team was able to vaccinate more than 50 veterans for the first release of the vaccine. Arlene Bainagan. Arlene is an influential leader with an excellent background in patient care, management, and hospital administration. Education is a passion for her, and it is obvious by the educational opportunities she completes and offers to the nursing staff in her department. She is a dynamic individual who possesses exceptional intellectual ability to make critical decisions and has earned great respect for her impeccable problem-solving and decision-making skills. Her passion and ability to motivate others, along with the strong advocacy and commitment to high-quality patient care, is very inspiring. She is highly regarded by her colleagues as an exceptional role model. Since assuming her management role, she has challenged her staff to become board certified and to go up the clinical ladder. She is committed to lifelong learning and is now pursuing her law degree. Prasanna Barakal. As a nursing supervisor, she had to take care of issues with the psych patients and the staff dealing with the issues that arose. She provided support to the staff, ensured the safety of patients and staff, followed infection control precautions during the pandemic crisis time, and assisted the staff to have resilience in their difficult times. Close observations are recommended and enforced for patients with behavioral issues. Therapeutic communications and frequent rounding help the staff to have visible support during times when there is an intense environment on the psych floor. Classes were offered through team steps, and she also encouraged the nurses to have better social life through Toastmasters. She facilitated nurses to attend community activities, charity works, and webinars so that psych nurses have a professional growth and a sense of belonging in their community. Psych nurses were given on-the-spot recognition, thereby their potential for growth was highlighted. This wrapped up the nominees for the Leadership and Management category. SAPNA is proud to announce the winner. And the winner for Leadership and Management of the Year award goes to Cynthia Links.
Hello, my name is Cynthia Links. I am an educator of undergraduate and graduate nurses at the University of Texas Health San Antonio. I've been a professor since 2015, teaching psychiatric mental health nursing and nursing leadership and management courses and clinicals. Prior to joining the university faculty, I worked and taught in military, public, and private healthcare systems. I'm a passionate person, and especially about teaching the next generation of nurses, and feel privileged to have the opportunity to impact future healthcare providers and the healthcare system. I view myself as a servant leader with the goal of expertly supporting and mentoring each student as they journey through their clinical experiences. My hope is these nurses will use newly acquired therapeutic communication and leadership skills to improve their lives and the lives of their clients. Thank you, Sherry Makerly, for nominating me for the San Antonio Psychiatric Nurses Association Award.
According to the National Institute of Mental Health, 68% of adults with behavioral health conditions also have medical conditions. However, electric medical beds have been deemed too dangerous for this patient population. The use of medical beds for patients with a behavioral health diagnosis has traditionally been the elephant in the room, until now. Sizewise has partnered with experts in the behavioral health community to develop an industry first, a fully functional electric medical bed that is safe for use in the behavioral health environment. The Sizewise behavioral health bed was designed with the same clinical advantages of competitive acute care beds, with the added benefit of key safety features that ensure not only patient safety, but also that of the care providers. The Sizewise behavioral health bed is proudly manufactured in America.
Moving on, our next category is Community Service Award. Points are awarded based on the following criteria. Must have been president or chairperson of at least one well-established professional, civic, or community organizations. Contributed to the psychiatric community's patient, family, and community psychiatric services enhancement. Most have been recognized for significant contributions in enhancing the image and quality of life in psychiatric community. Our nominees for the Community Service Awards are Sandy Elizardo. Sandy Elizardo is one well-rounded nurse with combined experience of med-surg, critical care, and psychiatric nursing. I can truly say that she is one knowledgeable nurse. An astute in business dealings, she ran a small business of care home for the elderly and disabled with 8 employees. This business made a difference in the lives of the patient. Community service is one of her largest strengths. With her prosperous business, she was able to reach a small community, run organizations, and donate money for charities she supports coming from her business money. She opens up her heart to these institutions and donates what she can give. Jeannie Jimenez. Jeannie's greatest strength is her determination to be able to take the grasp of unfortunate situations in the community and helping out through community outreach programs she leads. For the year 2021, she has planned to be putting up a monthly donation drives and various outreach programs. She has been successful as of right now. Jeannie's the chairperson for the Recruitment, Retention, and Recognition Committee in the Inpatient Psychiatric Unit in University Health System. She continuously leads the committee within the unit. She has managed to create funds that later on helps to extend help in the community services and donation drives. Jeannie has done this by prominently leading bake sales among her RR committee members. Denise Martinez. Denise is one of the community mental health resource registered nurse. One of the veterans on Denise care has major depression with suicide attempts in the past and multiple medical problems to include cancer and diabetes. In response to COVID-19, a lot of the face-to-face visits in the home were stopped to protect our veterans and our staff. When Denise could not get hold of the patient by phone, she drove to the house, knocked on the door, and stood 6 feet away to her COVID assessment. She continued to provide care for the veteran to help with his medical compliance. Celestina Ngang. At first, Celestina worked as a kindergarten teacher. From 2002 to 2007, she worked specifically with French children to assist them in learning English language. Every day, she came in doing what she always loved, and that is helping others in any way possible. That caring mindset is what pushed her into nursing field. In 2012, while living in California, she got her LVN degree. She used the degree as a home health for 6 months until moving to Texas to even further grow in her nursing career to become an RN. To enrich her skills and professions, she embarked on a part-time employment at a major psych hospital here in San Antonio. I have seen her firsthand lovingly care for each patient in such kind, compassionate, and professional manner. Chester Sadzad. Chester has always been a silent leader in the unit. At his young age, he shows excellent leadership with the help and support of his mentors and managers. He became an influential and outstanding charge nurse and preceptor. Currently, he is studying for his master's degree in nursing, specializing in administration and management. Chester has been an advocate for people who have mental health disorder in the community of San Antonio. He promotes, supports, and participates in mental health programs, even such as Out of the Darkness Walk by the American Foundation for Suicide Prevention and the NAMI, which is National Alliance on Mental Health Walk. He is one of the people who initiated and organized food donations alongside his co-worker and donated gathered goods to the San Antonio Food Bank. He also volunteered to give free COVID vaccines at the University Texas Health Science Center in San Antonio with the collaboration of the Philippine Nurses Association of San Antonio. Marta Vives. Dr. Vives, native of Puerto Rico, has been a registered nurse since 1981 and a psychiatric advanced practice nurse since 2002. She developed leadership qualities while serving as an Army Nurse Corps officer for over 26 years, as a psychiatric nurse practitioner, preceptor, faculty, and mentor to many. When COVID-19 pandemic restrictions took place, she effectively used information technology to deliver education to telebehavioral health using virtual simulations. She also provides virtual behavioral health education to family nurse practitioner students in a remote location in Texas who provide care to an underserved population in the border. She is always looking to meet the needs of vulnerable population or people of color. She provides psychiatric care to include medication management and psychotherapy to women, a vulnerable population of mothers and their infants suffering from substance abuse. Patient at Jewish Family Services, employees and students at the nurse-led clinics she works at. Sarah Williams. Sarah strives for cultural competence, practice cultural humility, practice individual and group sessions for elderly widows of color who have lost spouses. Her services as a grief recovery specialist are in demand from community demand among these times of COVID-19, where there are many suffers from depression and isolation. Service to the community includes help to close the gap in health disparities among African American and Hispanic population in the east side of San Antonio. Since retirement, continuous involvement in advancing nursing, advocating for DEI as a volunteer community servant. Past 3 years coordinated annual health fair for local church community. 300 parishioners benefited before COVID-19. Authorized bi-monthly commentary for church bulletin reaching 200 to 300 parishioners each day. Facilitated education seminars on aging, nutrition, and diabetes management. These wrap up the nominees for the community service category. SAPNA is proud to announce the winners. Due to a tie, the executive board decided to give the tied winners the award. The winners for the community service of the year awards goes to Jeannie Jimenez.
Hi Hi everyone. I'm extremely honored to be receiving such an important award. I am earnestly grateful for the recognition I have received for my work because I am sure that every other nominee for this award was as capable, if not more, of winning this award. Winning the award would not be possible without the inspiration I have received from God, my mentors and colleagues, family and friends, for whom I have deep respect and derive the strength to challenge myself and perform better, for making me who I am today. They saw passion in me when I couldn't see it myself. I am blessed to have them in my life and makes me want to only do better than I ever did. From my humble beginnings 27 years ago, I want to continue this journey to being a dedicated pioneer, a role model for compassion and service, and to be striving to make the world a better place with significant contributions to the community. I am honored to represent outstanding psychiatric nurses of San Antonio. Thank you.
Marta Vives.
Good evening, colleagues and friends. I am honored to be the recipient of the Psychiatric Nurses Impact Award. I am exceptionally grateful for the recognition I have received by the San Antonio Psychiatric Nurses Association for my service. I have no doubt the task of narrowing their selection to only a few individuals must have been difficult. Therefore, I accept this award not only as a personal accomplishment, but as the collective accomplishment of the San Antonio nursing community as a whole. For over a year, most nurses have faced the greatest challenges of their careers. I think it is safe to say these challenges have not only strengthened us as humans, but as professionals who will continue to give to the community until we are living in a safe and healthier environment. The recent experiences endured over the most unprecedented times in our lives has enforced purpose and drive in all of us. Set your eye on a goal and do not lose sight of it until it is accomplished. Serving the community is what we do best because it is our calling. Albert Schweitzer said, I don't know what your destiny will be, but one thing I do know. The only ones among you who will be really happy are those who have sought and found how to serve. Winning this award will not have been possible without the inspiration I have received from my mentors and my colleagues, for whom I have the deepest respect and from whom I have derived the strength to challenge myself and perform better at each stage of my profession. I sincerely thank each one of you and my colleagues at UT Health School of Nursing for helping me reach a stage where I can proudly hold up this award as a mark of a collective achievement. I also promise to only get better at my work and to continue to inspire others to follow our footsteps. To all of you, thank you.
Our next category is Education and Research Award. Points are awarded based on the following criteria. Must be a faculty in a school or college of nursing, in service or continuing education for at least 2 years. Must have significant contribution in the field of nursing in general, involvement in the nursing education as an organizer, participant, and or lecturer. And lastly, must have been recognized for a significant contribution in the field of nursing in psychiatry. Our nominees for Education and Research Award are Maria Danet Lapis Bloom. Unique to psychiatry is the lack of understanding of the etiology of diseases, which often hinders the development of treatment strategies. One of the very few nurse preclinical scientists Dr. Bloom's research contributed to understanding stress-related biological mechanisms in mental health disorders and animal model development to test novel therapeutics for depression and anxiety. At H. Lundbeck AS in Denmark, she was involved in the testing of preclinical effects of compounds such as escitalopram, atomoxetine, and memantine. Data from the studies help move forward indications for the drugs and understand some of the mechanisms related to the depression and anxiety. At UT Health San Antonio, she developed an animal model to test cognitive flexibility, a cognitive function challenging to emulate in lab settings. The model has now been used in several labs throughout the world. Gail Boring. Gail Boring works as a clinical learning consultant from University Health System. She specializes in teaching American Heart Association-centered trainings and the Satori alternative for managing aggression. She is the clinical lead on training staff on how to effectively deal with psychiatric aggressive and destructive patients. Therapeutic communication and proper containment is her forte. She is now pursuing her DNP, and her dissertation involved training staff on patient-to-staff violence reporting. This encourages staff to report any harm or violence done in the workplace, thus empowering staff and normalizing what was the impression before that workplace violence from patient to staff is okay. She put up educational materials and posters on all the units she targeted, such as the behavioral and psychiatry units. She also organized classes that would enrich the knowledge of the staff in regards to the materials she is teaching to research and study on. Staff are appreciative of the learnings and knowledge she shares for the whole system across the board. Karen Davis. Born and raised in the Mid-Atlantic area of the U.S., she began her nursing career 28 years ago as an ADN. She completed her bachelor's degree in 2008 with a great GPA and graduated with her MSN in 2012 with a cum laude degree. Functioned as a clinical nurse specialist for 5 years in ICU and ER, and had the additional role of primary nurse education in Western Alaska during this period. She functioned as the nurse educator for 5 years in assorted LPN and ADN nursing programs in Virginia and Texas. The opportunity to provide care and patient teaching as a member of her church missionary program, she traveled to the Brazilian rainforest during 2 summers in 2010 and 2012. During these trips, she assisted to set up healthcare clinics, provide patient and family health education, administered medications, and provided basic first aid. She said that for many of those people, our clinic was the first time they received any type of healthcare services. The clinics she founded continue to meet and expand upon their core mission of patient engagement while meeting the care needs of their patients. Leticia Flores Canchola. She has earned a master's in nursing with concentration in clinical nurse leader, bachelor's in nursing with psychology minor, and is currently enrolled in a PhD program specializing in nursing education with a projected graduation date in December 2021. She is the full-time clinical educator for University Hospital's Controlled Access Unit, Psychiatry, and General Medicine units. She has most recently provided orientation for COVID crisis nurses and training on the COVID Code Blue guidelines. She has over 24 years experience as a psychiatric nurse at both the direct care and management levels and 15 years experience teaching psychiatric and mental health curriculum and clinical at the baccalaureate level, certainly qualify her as an experienced clinician and educator. She is a nursing faculty at the university teaching psychiatric mental health clinic, Mental health awareness in caregivers has become even more important with COVID-19 and the anxiety experienced by patients and families, and also teaches a class in the nurse residency program. Her goals are destigmatizing psychiatry by teaching patient communication, helping residents analyze biases and fears related to patients with psychiatric issues, discussing cultural differences and attitudes towards mental health, teaching interventions and tactics for protecting themselves, and how a professional nurse cares for the whole patient, not becoming entangled in a singular task-based focus. Rapport, safety, building trust, and understanding are the keys to how a professional nurse cares, are the foundation for Letitia's message. Rhonda Gottlieb. She is the Director of Clinical Health at the Health Services Office at the Incarnate Word University, one of the largest Hispanic-serving institutions. Her greatest psychiatry contribution is she recently completed an evidence-based research program that focused on identifying at-risk college students. Her philosophy is that it is important to identify students who may be experiencing depression as a result of leaving home for the first time, academic and social pressures as well. Her program screens college students for depression and connects those at risk with mental health professionals. She also played a vital role in crafting an evidence-based plan for preventing the spread of COVID-19, devising methods for screening, conducting contact tracing, infection management, isolation, quarantining, and monitoring. She is a highly effective communicator, speaking easily with student, faculty, and administrative leadership groups, taking Q&As and posting videos. She has a significant leadership role in coordinating the campus response with the San Antonio Metropolitan Health Department, monitored activity across other U.S. college campuses, communicated with experts on best practices, all with an eye towards maximizing safety and health on campus, and the larger aim of preventing the campus from becoming a hotspot that would threaten the larger vulnerable populations of San Antonio. Sherry Megerly. Sherry is an assistant professor from UT Health Science School of Nursing. She has 23 years of nursing experience and expertise. With her master's degree specializing in forensic nursing, she helps and guides forensic patients get competence and be at their best to stand in trial and to be able to speak for themselves. She is patient advocate in this way. She is also a competent SANE nurse that responds to physically abused and rape victim patients. She is currently finishing up her PhD in forensic nursing. She is not only advocate for patients, but for nursing students that are trying to enrich their knowledge in the nursing field. She is a professor that greatly encourages students to resonate their highest potential by improving study techniques and methods, increase community engagement and therapeutic, and also utmost respect in communicating with patients. One of the greatest achievements that Ms. Megerly did this year is that during the peak of vaccinations need for the city of San Antonio, she gathered her students and formed teams to help the vaccination drives that UT Health organized. They have vaccinated over 2,500 residents per day, and I think that is a great feat for her and her team as they have successfully been doing these drives since December 2020. And this is the end for all the nominees in this category. Before the winner announcement, the board would want to inform everyone that in this category, once again, we have a tie. The board decided to separate the awards for education and research. So we have 2 awards for this one. I think this is a great idea. So the winner of the Education and Research Awards are Maria Danet Lapis Bloom.
Hello, I am Maria Danet Lapis Bloom, Associate Professor and the Director of International Programs at UT Health San Antonio. I thank the San Antonio Psychiatric Nurses Association for organizing these Impact Awards, which truly recognizes the important role of nurses in mental health. I thank the support of the nominator. For the more than 20 years as nurse and neuroscientist, I have had exciting career that impact mental health. Some of these include research on the underlying neurobiological mechanisms for depression, post-traumatic stress disorder, and anxiety, development of drug targets, as well as community and patient-centered outcomes research among vulnerable populations, as well as the education and mentorship of students. I plan to move forward, continuing this trajectory to help improve patient outcomes, especially on mental health. Thank you once again.
Leticia Flores Canchola.
Psychiatric nursing has been my passion and love for the last 24 years. Advocating for the mentally ill provides a voice to the voiceless. It is an honor to accept this award on behalf of the San Antonio Psychiatric Nursing Association. As an educator, I provided knowledge to students on how to care for a psychiatric patient on a psychiatric unit, though it is important to provide education to nurses in providing holistic treatment to every patient. I have a saying, your nursing knowledge will ignite the light of a new nurse. It is through that light that your nursing knowledge will reflect. Thank you to those who believe in me. I am humbled and grateful for your nomination. I am truly blessed with the love and support of my husband, Albert, my daughter, Andrea, my whole family, and my friends. But above all, I am thankful to God who has placed me in this career path of psychiatric nursing. Thank you.
You're on a mission to run a system that makes a difference. But at the end of the day, you might feel like you're spending more time managing dollars and less time connecting with your community. You might be talking more about performance scores and less about delivering patient care, moving you further and further away from your focus. Everyone's feeling the pressures impacting healthcare today, but everyone's situation is different. Take your system. You could be this, or this, or this, or this. The point is, your system is unique. You have your own goals and your own vision of where you want to be and how you want to get there. A one-size-fits-all solution may not be the right fit for your system. You deserve a partner who sees the big picture and all the little details that go into building it. Someone who takes the time to understand what makes your system unique, works out the challenges, and stays with you. Medline is that kind of partner. We're built for creative problem solving, helping you improve outcomes by reducing variation in care, build loyalty by deepening connections with patients, work more efficiently by spending less time on non-clinical activities, reduce supply costs by zeroing in on smarter spending. We keep things running smoothly by filling in the gaps. We look for opportunities to help you grow. At Medline, we take on your challenges as if they're our own. We ask ourselves what can be done and think about the answers on the drive home. We roll up our sleeves, learn about who you are, where you want to go, and co-create a plan that's just right for you. At Medline, it's all about working together to free up the resources your system needs to use in places like this, or this, or this, so you can deliver this. We can do this because our business is designed to help your business run better. We have the financial strength to invest in the things your system needs, and we have the agility of the fast-moving, do-whatever-it-takes, family-run startup that put us on the map years ago. And in the 50 years we've been building our business, our approach hasn't changed. Medline's designed to help you do what's right for one person, while making sure you have the resources to keep doing what's right for every person, in every care setting, in every stage of life. This is Medline.
Good afternoon. Our next category is the Clinical Practice Award. Points are awarded based on the following criteria. The nominee must be currently practicing in a clinical field of nursing and must have at least 2 years of experience. They must also have made significant contributions to the practice of psychiatric nursing and have contributed to the psychiatric patients, family, and community's psychiatric services enhancement. Finally, they must have been recognized for meritorious contributions to the field of psychiatric nursing. Our nominees for the Clinical Practice Award are Raymond Bosca. Raymond demonstrates great patience and courage while working in UHS psychiatry. For weeks, there was a very agitated patient who was considered very dangerous at times. At the time, all the patient could see was red and was determined to demolish the unit. Raymond stepped out of the nurse's station and spoke with a calm and concerning voice towards the patient. He demonstrated great empathy and restated the patient's concern in an effort to de-escalate the situation and let the patient know that he was heard. John Bedman. John is a floor RN who was always pulled to act as house supervisor in times of need. He is an RN who always observes the policy and procedures to maintain consistency in the management of the staff as well as the patients. And he was just promoted as a house supervisor. LaToya Charles. LaToya started her career in SASH in 2004 as a PNA. She left in 2011 to pursue a nursing degree and completed her LVN coursework and became registered in 2014. She worked at Laurel Ridge, then came back to SASH in 2020 to work in the Psychiatric Intensive Care Unit. She has proven herself to be a great team player, dependable, punctual, and often picking up extra shifts to ease the campus-wide shortage. Her interactions with the patients are marked by kindness, respect, compassion, and professionalism. She mentors newcomers with patience and a good dose of encouragement. Amanda Durow. Amanda has been admired for her work ethics and unreserved support on the psychiatric unit. She's one who is always going out of her way to assist the patients regardless of how busy she is. She exemplifies exactly what kind of nurse psychiatry needs by providing structure for the patients and encouraging them to be better to reach their goals. Of all else, she shows unconditional patience when communicating with her patients, especially those with lower levels of functioning. UHS Psychiatry is fortunate to have such a strong-minded and committed nurse on their team. Janice Dulnuan. Janice is full of light and positivity, and her patience knows no end for both patients and staff throughout the unit. She's one of a kind in how she cares for others. Janice once cared for a patient with major depressive personality traits. The patient did not care to eat or drink, much less shower, for days. For many shifts, she worked hard to communicate with this patient. She never faltered and continuously encouraged this patient to consume meals, to showers, and to take their medication. She is a dedicated nurse and provides excellent care and education to psychiatric patients. Marissa Hernandez. Marissa Hernandez has been working as a house supervisor in psychiatric hospitals and has long-term experience as a director in a group home for child and adolescents. She is the epitome of a caring and compassionate nurse and a nursing leader. She always advocates for her patients' welfare. Joseph Jackson. Joseph, known as Joe, is very compassionate towards his patients and is a very calm and resilient nurse. He is a floor RN who understands the balance of interest between the management and employees. He is also very approachable to patients in the high acuity unit. Sheila Joyner. Sheila is an excellent nurse and goes out of her way to care for her patients. There was once an incident where a patient was strictly Spanish speaking. The patient was shouting and demanding his morning medications. She kept very calm and informed the patient she would be right back, that she wanted to understand what they had to say. Sheila searched for the language interpreter and set aside several minutes to allow the patient to be heard. Sometimes a rapport isn't obtained between staff and patients on the unit, but Sheila is a prime example of patients being the middleman. There was a language barrier, and though she did not respond to the patient exactly as they requested, she did the patient one better. She gave the patient her undivided attention, time to voice his troubles, and was able to solve the patient's concern. Jan Lester Langusta. Jan Lester has greatly impacted psychiatric nursing, as he significantly contributed in promoting safety and security on his patients in mental health crisis. He always carries his compassion, enthusiasm, and charisma with him when he does patient care, making it easier for the patient to trust him as a mental health nurse and advocate for them. He is never hesitant and discusses patient issues with a team, and he takes initiative in decision-making or suggestion for the benefit of keeping patients safe, secure, and satisfied in meeting their mental, emotional, and physical needs, and meeting their concerns in a timely manner. Jan also facilitates safe, quality care, as he always uses effective verbal de-escalation techniques to prevent patients from harming self or others and preventing the destroying of property. Jen also received numerous Daisy Awards and other recognitions both from patients and colleagues due to outstanding and excellent quality care and teamwork. He demonstrates excellence in nursing education and clinical nursing by using evidence-based nursing practice, leadership skills, effective communication, and collaboration. Marlon Mantering. Marlon is exceptional at building rapport with patients and talking out problems with them when they feel like their world is crumbling around them. He's a jack of all trades when it comes to nursing, juggling multiple tasks at once. There's no task too big for him because he always finds a way to manage it while still remaining cool, calm, and collected. He looks at every situation with great detail and takes into consideration each possible outcome. This in turn makes him an outstanding charge nurse on the unit. Marlon is a great and exemplary nurse to work with, as he is always ready to help and solve problems. He has good leadership qualities and performs his duties with diligence. As a charge nurse, not only does he handle psychiatric matters, but he also helps with the medical surgical unit at UHS. Michael Monceau. Michael is a charge nurse at Clarity Child Guidance Center. He is always ready for the challenges each day will bring, whether it is to charge a 22-patient unit or to man the admissions area. He is admired by his peers for his knowledge of psychopharmacology and his continued desire to always learn more. His path to becoming an RN was different than most. He became homeless at 16 and did not finish high school, but eventually went back to earn his GED. He then attended university for a computer science degree and after an anthropology degree. After getting his dream job in Japan as a film composer, his father unfortunately passed away. At the funeral, he searched for his friends and learned many were in prison, homeless, or using drugs. It seemed as though he was the only one to change his life around, and he realized then that he wanted to return to school for mental health with the hopes of helping others like his childhood friends. Geneva Nevilles. The stigma of suicide keeps suicidal people from getting help. Moreover, there are nurses that have a difficult time asking crucial questions regarding depression and suicidal thoughts because they are an uncomfortable topic. Miss Geneva was walking to the cafeteria for a hot cup of coffee on a cold November morning, and she recognized one of the vets from the BHIP same-day access clinic eating his breakfast in the dining area. She greeted him, and he requested to speak with her for a moment. She spent a few moments speaking with him and recognized he was in distress, and he voiced thoughts of harming himself. She then recommended to him that she escort him to the ER for further evaluation. The patient was admitted for SI onto the inpatient unit. ESO Bong Orgy. She has been a valuable member of the psychiatric unit and is an excellent role model, team member, and team player. She advocates endlessly and gives patients the best quality care and ensures their safety. She is always there, willing to give a lending hand to anyone who needs assistance with a difficult situation, without complaints or hesitation. She genuinely loves what she does, and her compassion towards her colleagues and patients is excellent. She has a wonderful bedside manner, and it shows throughout the numerous acknowledgments and Daisy Awards she receives from her patients and fellow staff. She is a huge asset to the unit, is very respectful, a hard worker, and is dedicated to all she does. Cynthia Ann Plata. Having been a charge nurse for so many years in the psychiatric nursing at Laurel Ridge Treatment Center, Cynthia pretty much knows everything encircling psychiatry and mental health nursing, until one day she had a code blue in one of her units and was the charge nurse. She admitted that she didn't know what to do, as this is an emergent medical case. Being a nurse who values great knowledge and lifelong learning, she knew right away that her knowledge was only mental health nursing was not enough. She ventured and looked for another job that would greatly teach her in the med-surg area of expertise. This is something that nurses need to emulate from Miss Plata. Thirst for new knowledge and challenges and seeing things in a new perspective to grow. Andrea Quintana. Andrea effortlessly interacts with patients on the unit. She does not show fear once while working with her patients. Some time ago, there was a pregnant patient on the unit experiencing an anxiety attack. The patient was loud and inconsolable, voicing how she felt she wasn't going to be a good mother, that she had no idea what to expect with pregnancy, and that she wanted to give up. Andrea walked over and gave the patient a hug, asked the patient to take a walk with her down the hallway, and from there they talked. Andrea used her knowledge as a nurse to educate the patient in distress of what she could expect throughout pregnancy. The patient's anxiety was immediately eased with Andrea offering just those 15 minutes of reassurance. Of all else, this wonderful nurse encourages her patients each day to reach their goals and reminds them that they will get through this unfortunate time. Maria Selena Ramirez. Maria Selena is the most compassionate, loving, professional nurse. She takes her time to listen, to care, and to extend assistance whichever way she can. The comfort and well-being of her patients is the order of the day each time she is on duty. She will not compromise her integrity no matter what. She has the patience of a saint, and she is able to manage difficult, bullying coworkers. With clarity and candor, she conveys her stand on a situation, keeping her emotions under tight control. She is a nurse worth emulating by new nurses. Roland Sawyerland. Roland is the quintessential psychiatric nurse. His current job as an RN case manager has him functioning not in a clinic or as a hospital unit-based nurse, but as a home health nurse caring for specialized patient population. military veterans with serious mental illness. As such, he sees patients not on his own home ground, but wherever the veteran is out in the community. He advocated for a patient in the VA ER who was medically compromised. ER staff felt that the patient only needed psychiatric services, but Roland pushed to get the necessary lab work and testing done so that the patient would be treated for the medical issues that were life-threatening for the veteran. During the inclement snowy weather San Antonio experienced this year, Roland put his own life in jeopardy by driving all the way to New Braunfels to get a patient the injection that he needed. In the past, he assisted a patient at her home when he, at his own cost, repaired a hole in her floor so that she could be safe. He then contacted social work to assist this patient in obtaining the permanent repairs needed for the home. He has advocated for this very vulnerable population by communicating with landlords and property managers to ensure the patients are not being taken advantage of. He maintains a calm demeanor in the most trying and volatile of situations. Daily, he demonstrates the skills of being a nurse through kindness, empathy, and strength of character. As an Air Force veteran himself, he continues to serve and honor his community through his duties as an RN case manager. And this wraps up the nominees for the clinical practice category. SAPNA is proud to announce the winner. Congratulations, Mr. Jan Lester Langusta, for winning the Clinical Practice Award.
Hello, my name is Jan Langusta, and I've been working as a registered nurse for 15 years with a specialty in a psychiatric field. It is a great honor to be associated with this organization whose goal is to eradicate mental health stigma by providing educations and support to all the members, including myself. I have been a member of SAPNA for 2 years, and to be nominated for the Impact Award is truly humbling experience, given that my main drive is to advocate for mentally challenged patients. Within my 15 years of experience as a nurse, I have cared for many patients who have taught me multiple lessons. Therefore, my future goal is to get certified in mental health and become a nurse practitioner someday. Again, thank you for this nomination. I thank for my wife, my family members who will help me a lot and to become a great nurse.
Hello and good afternoon to all of you. I am Maria Lourdes Cruz, the current president of the San Antonio Psychiatric Nurses Association. And in behalf of the Board of Officers for the year 2021, we would like to congratulate all the nominees and the winners. We are nearing to the end of this program, but as we have promised, we will be giving 3 special awards. The special awards winners were chosen by the Board of Officers. And in each award, I will be explaining the mechanics of how they were judged, the criteria, and how we came up with the winners. Our first special award is the Rising Star of the Year. This award embodies great improvement of a newly graduate registered nurse in the field of psychiatry in the category of clinical practice and education. They seek for greater knowledge and seek growth in every opportunity that they have. This person also gained the trust and confidence of their peers when they are in the clinical area and has demonstrated a high level of professional achievement with strong leadership qualities and strong commitment to professional advancement. And the winner for the Rising Star Awards goes to Chester Sadsad. His nominator wrote, Chester has been working at the University Hospital in adult psychiatry for 2 years now and has always been a silent leader in the unit. At his young age, he shows excellent leadership with the help and support of his mentors and managers, and he became an influential and outstanding charge nurse and preceptor. During his nursing residency program, he made a study about do's and don'ts on aggression de-escalation techniques at the bedside. He was able to teach and educate his co-nurses, staff, and medical health providers in different clinical areas who are taking care of aggressive patients. He shows that he can be a great leader and has skills in care coordination by keeping all his patients safe and maintaining the unit in order and well-staffed. In addition, he received multiple DAISY nominations, and also he was nominated for Clinical Staff Rising Star Award sponsored by the Philippine Nurses Association of San Antonio. He is now taking on the journey of applying for his specialization to be a certified nurse at ANCC Psychiatric Mental Health Nursing. Currently, he is studying for his master's degree in nursing, specializing in administration and management. And he is eagerly seeking to train in the medical surgical unit to expand his nursing skills to benefit psychiatric patients with medical components. He demonstrates himself to be an extraordinarily bright and capable individual with genuine compassion and care for patients. Chester has been an advocate for people who have mental health disorders in the community of San Antonio. He promotes, supports, and participates in mental health programs and events such as the Out of Darkness Walk by the American Foundation for Suicide Prevention and the National Alliance on Mental Illness Walk. He is one of the people who initiated and organized food donations alongside his co-workers and donated gathered goods to the San Antonio Food Bank. He also volunteered to give free COVID vaccines at the University of Texas Health Science Center in San Antonio with the collaboration of the Philippine Nurses Association of San Antonio. When Chester first started at the psychiatric unit, it became evident that he took his position very seriously and was genuinely interested in his chosen specialty. Patients commented on his excellent bedside manner and his highly professional work style. He brings joy and laughter to all his patients with respect and dignity. Chester was well liked throughout the unit, and he is always volunteering to help his co-workers when they were having an emergency, such as caught grins or restraints. He is a true team player that also has a strong interest in helping patients. Congratulations, Chester Sadsad, our Rising Star of the Year.
Hello, everyone. I am truly humbled and honored to receive this award and be recognized by the San Antonio Psychiatric Nurses Association for their first Psychiatric Nurses Impact Awards. Thanks to my family, peers, and mentors for giving multiple pieces of advice and guidance, and of course, God for giving me an amazing gift and talent to share and inspire other people. Receiving this award gives me pride, joy, and accomplishment. This award was possible because of all amazing psychiatric nurses that have inspired me throughout the 3 years of my nursing career. Again, thank you for this honor. Let's break the stigma. Mental health matters.
Next special award is the Scholar of the Year. This winner was chosen through the profile submitted and should be currently attending school. May it be associate, bachelor's, master's, or doctorate degree, this individual will be recognized for his hard work in continuing his education and trying to reach the greater heights. The winner will be awarded $500 scholarship money from the SAPNA Scholarship Committee. The winner of the Scholar of the Year award goes to Michael Monsu. Michael is always ready for the challenges each day will bring, whether it is charting a 22-patient unit or man the admissions area. He is admired by his peers for his knowledge of psychopharmacology and his continued desire to always know more. His path to becoming an RN was different than most. He became homeless at 16 and did not finish high school, but eventually went back to earn his GED. He then attended university for a computer science degree after an anthropology degree. After he moonlit at music studios and got his dream job as a film composer in Japan, his father passed. At the funeral, he searched for his friends and learned many were in prison, homeless, or using drugs. It seemed as though he was the only one who changed his life around and realized then that he wanted to return to school for mental health with the hope of helping others like his childhood friends. He is now pursuing his Master's of Science in Nursing and wanting to be a psychiatric mental health nurse practitioner, while simultaneously earning a certification for mindfulness and meditation. He realized the importance and impact that meditation has brought to his personal development and plans to utilize his training during his work as a psychiatric nurse. Congratulations, Michael Mansu, our Scholar of the Year.
Hello, my name is Michael Monso. I'm a psych RN at Clarity, currently undergoing advanced psychiatric studies. Getting into psych was a major undertaking for me. It was a big 180. I had been living my dream job in Japan as a film composer, but on a visit to the US, I saw how badly a lot of people were doing, and so I made the decision to go back to school and study mental health, and here I am. In all honesty, a lot of it was kind of frightening because it was just such a big deal, and like I said, just such a change of events, and I was really worried whether or not I'd made the right decision. But I'm so glad that I did. I love the work that we do. I love it. So thank you, Clarity. Thank you, the San Antonio Psychiatric Nursing Association. Thank you, San Antonio, for being so accommodating. And really thank you, everyone who is involved in mental health work. And that goes for the patients as well, because they help us too. So thank you.
And now, for our last awardee, the Hildegard Peplow Impact Nurse of the Year goes to the psychiatric nurse who have impacted the psychiatric and mental health community with the impeccable contribution during the COVID-19 pandemic period and has demonstrated the heart of nursing through their positive impact on the individual, family, and community. This nurse greatly made effort to help the mental health population during these trying times and who have gone above and beyond to ensure safe, high quality, high value, sustainable health care to respond to the COVID-19 pandemic. The winner of the Hildegard Peplau Impact Nurse of the Year is Tamara Marquez de la Plata. In light of COVID, vaccinations this year were more important than ever. Ms. Marquez de la Plata collaborated with social work in the homeless program and pharmacy to go out into the community and vaccinate veterans who were residing in the homeless shelters, which include the Haven for Hope, the GI Forum, and the Summit. Through her leadership, she pulled together a team of 3 nurses and created a mobile clinic to vaccinate over 70 veterans using the 2-shot vaccine from Moderna. Later, when the single-shot vaccine became available, the same team of nurses were again tasked to ensure this vulnerable population had access to the vaccine. She knew that getting the homeless veterans 2 doses would be hard to accomplish. So when the Johnson & Johnson vaccine came out, she led and rotated the nurses again for the mobile COVID vaccination clinic. With Tamara's coordination and leadership, the team were able to vaccinate additional 50 veterans. Once again, congratulations, Ms. Tamara Marquez de la Plata, our Hildegard Peplau Impact Nurse of the Year.
Good evening. I just want to start off by saying thank you so much for this nomination. As you all know, our mental health population and our homeless mental health population are an extremely vulnerable population. And during COVID last year, there were patients that may not have felt they had the best access to care, or maybe their mental health kept them from feeling like they could come to the hospital and receive care. We really wanted to make sure that those veterans still had access during the pandemic, and we knew that getting them the flu vaccination and the COVID vaccinations were really critical for this population, as they may not have had access to masks or may not have had access to social distance. I was able to spearhead a project with social work and with pharmacy, and we stood up this year our first ever mobile flu clinic. We took a team of nursing staff to include Corey Beasley, Phyllis Manning, and Danye Gibbs, and we were able to go down to the homeless shelters to include Haven for Hope, the GI Forum, and the Summit, and give over 70 vaccinations, flu vaccinations to our homeless veterans. In January this year, when we started to get our first doses of the COVID vaccine, we knew we wanted to hit the ground running again. But we knew that was going to be a task with the COVID and the Pfizer and the Moderna vaccine. So the second we got the Janssen vaccine, which we knew was a one-time dose, we arranged with pharmacy to make sure that those doses were held aside for the homeless vaccine. And we stood up that mobile COVID vaccine clinic for the first time ever. We hit our feet on the ground and we were able to go back to Haven for Hope, go back to the GI Forum, and go back to the Summit and vaccinate over 50 veterans with the Janssen dose. So I just want to say that I really appreciate the nomination, but this was not possible without the whole help of all the outpatient mental health nurses. They were able to cover so that we could go out into the community and do this. So a big shout out to the South Texas Veterans Healthcare System nurses. They always seem to rise to the occasion, and thank you again for this nomination. Have a wonderful evening.
There we have it. Before we close this program, I would like to take this opportunity to say On behalf of the SAPNA officers and members, congratulations to all the nominees and the winners. Despite these tough and unprecedented times, you continue to put others first. Every day, your compassion is appreciated, your dedication is admired, and your service to humanity makes a difference in the lives of others. May you be proud of the work you do, the person you are, and the difference you make. Thank you for being our nation's guiding light in the face of this adversity. This is what it means to be a hero. This is what it means to build a beautiful legacy. Thank you for all that you do. Have a good afternoon and may God bless us all.
Before we close the award ceremony, we would like to take this last opportunity to say that on behalf of SAPNA officers and members, congratulations both to the awardees and the nominees, alongside their families and friends who have supported the organization's vision to empower individuals during these trying times. It is clearly seen today that your outstanding achievements and well-deserved pride are overwhelming and is something to be proud of. It is not merely the end of the awarding of certificates and plaques and then be followed by hanging in your wall just for so many people to admire with and highlighting the great applause and tokens received. But rather, what exactly today means is accentuating the individuality on how far the winners set their limits to achieve their goals and accomplishments. We would also want to thank our sponsors for today's event and making it a successful one. Medline, Sizewise, University Health, the San Antonio Nursing Consortium, the Philippine Nurses Association of San Antonio, and the San Antonio Indian Nurses Association. We also want to inform and remind all about our CEU credits that are available for free. Credits that can be acquired are all free for as long as the classes were finished. If experiencing technical difficulties in acquiring certificates, please reach out to me, and my information and the education committee is flashed on the screen. Please look at the above link for our educational event CEU credits. So this ends our events for the day. We see you all next year for our educational and awarding event. Once again, the SAPNA family is extremely proud and happy of what we all have accomplished. Thank you, and we appreciate the time you have set up for today's event. Thank you.